Today, I'm revealing 4 scientifically proven methods that will dramatically enhance your masculine performance and sexual vitality. The fourth technique is so effective, yet unknown, that 95% of men have never even heard of it. Welcome, gentlemen. I'm Dr. Laura Bennett, and this is your definitive guide to optimized male performance. Sexual function isn't just about pleasure, it's fundamentally about vascular health, blood circulation, and peak physical conditioning. When you understand that peak erections require optimal blood flow, you realize this is really about total body wellness and cardiovascular excellence. Your ability to achieve and maintain strong erections depends entirely on arterial health and blood flow efficiency. Blood reaches your penis through a sophisticated network starting with the internal iliac artery, a major branch from your body's main highway, the abdominal aorta. This pathway branches into the internal pudendal artery, then divides into the cavernous, penile, and dorsal arteries that actually deliver oxygen-rich blood for peak performance. Here's what most men don't realize. When your vascular system operates at peak efficiency, everything else follows. This is exactly why doctors prescribe vasodilators like tadalafil and sildenafil. They temporarily optimize blood vessel dilation. But what if you could achieve this naturally and permanently? The foundation of masculine strength lies in your pelvic floor musculature. These aren't just any muscles. They're the powerhouse behind ejaculatory control, urinary function, and erection quality. Recent clinical studies demonstrate that pelvic floor exercises should be considered as a first-line approach for men seeking long-term resolution of their erectile dysfunction. To locate these muscles precisely, next time you're urinating, briefly halt the flow midstream. Those activated muscles? That's your target zone. Here's the protocol. Contract these muscles for exactly 5 seconds. Release slowly for 5 seconds. Complete 10 repetitions. Perform 2 to 3 sets daily. Minimum commitment. 6 weeks for measurable results. Men with stronger pelvic floor muscle strength show significantly better erectile function, with studies showing that maximal strength below 1.9 kilograms of force is an independent predictor for erectile dysfunction. But here's the game changer most men miss. Timing your contractions with your breathing doubles the effectiveness. Exhale during contraction. Inhale during release. Method number 2, vacuum enhancement therapy. This isn't your typical device. Vacuum therapy represents cutting-edge rehabilitation technology used by leading urologists worldwide. It's standard protocol after major procedures like radical prostatectomy and is included in clinical treatment plans for thousands of men. The cylindrical device creates controlled negative pressure, dramatically increasing blood flow and facilitating natural erection mechanisms. This isn't temporary, it's training your vascular system for enhanced performance. Here's the professional protocol. 10 to 15-minute sessions, 2 to 3 times weekly. Some advanced users incorporate daily sessions. Maximum session length, 30 minutes. Professional guidance is non-negotiable for first-time use. Improper technique can cause tissue damage, pain, or localized complications. Studies combining tadalafil with vacuum therapy show that patients exhibit superior rehabilitation and recovery of sexual function compared to those using only pharmaceutical intervention. Comment below if you've heard of this technology before. I'm curious how many of you knew this was standard medical practice. Method number 3, cardiovascular power training. Here's what separates peak performers from average men. They understand that sexual function is cardiovascular function. Meta-analysis of randomized controlled trials demonstrates that aerobic exercise results in statistically significant improvements in erectile function, with greater benefits for men with more severe baseline dysfunction. Men who exercise for 30 to 60 minutes, 3 to 5 times a week, saw improvement similar to that provided by common ED pills like Viagra and Cialis. This isn't just correlation, it's measurable physiological enhancement. The optimal protocol: 40 minutes of moderate to vigorous intensity, 4 sessions per week. Target 160 minutes weekly for 6 months. Activities include cycling, running, swimming, and high-intensity intervals. Aerobic exercise reduces inflammation,